Hi everyone, my name is Michelle Jones and I am a child life specialist at Shriners Healthcare for Children in the Twin Cities. Today we will be talking about having those difficult conversations about COVID-19 with your children and helping kids find positive and effective coping mechanisms during this time. Sometimes parents and guardians struggle to find the right words or are afraid of saying the wrong thing when it comes to challenging topics. It's important to acknowledge that we are all learning how to best educate our children about this pandemic, and there are wonderful resources out there that provide such guidance as we navigate these really unprecedented times. Through this presentation, we will learn developmentally appropriate language to educate children about COVID-19. The age groups we will look at are preschoolers, so 3 to 4 years of age, school-age children 6 to 12, and then adolescents 13 and up. Another objective is to foster an understanding about COVID-19's impact on children and how this may present in a variety of different behaviors. Also, we will acknowledge the parent and guardian's role in helping children effectively cope with this stressful circumstance. Lastly, we hope to provide you with valuable resources about COVID-19, from videos to handouts. These resources will offer advice and guidance on countless topics to better equip you with the tools necessary for the weeks to come. Before we dive in on how to talk with your kids about COVID-19, it's important to recognize how our children are being overwhelmed and its impact on development. With a simple web search, I was able to pull up these pictures that really depict terrifying and anxiety-provoking realities for what we are going through around the world. So television, internet, radio, and social media can be traumatizing with the constant breaking news and negativity. It's both what kids are hearing and seeing on a regular basis that can create really an unrealistic picture of the current circumstance and formulate unnecessary stress. So as you can see, we are constantly bombarded with the new death toll and the growing number of infected patients. So it's more than most adults can handle. So we can't expect our kids to cope with this information by themselves. From regression to sleep disturbances, this is just a short list of the effects of stress and trauma on children. When children are in a constant state of panic and anxiety, they are more susceptible to both mental and physical suffering. So therefore, we must be providing age-appropriate, honest, and accurate information in light of the pandemic to really help them process what's going on so they can go back to being just kids. So what are kids seeing? Masks, gloves, gowns, and even some goggles. In order to reduce the fear surrounding PPE or personal protective equipment, we can simply explain the purpose of each item and how it is used to keep doctors and nurses and just all of us safe. So I used Fuzzy as our doctor today, and you can really use any doll or stuffed animal, and play doctor using a medical kit at home. And it can really allow kids to ask questions, and then you can go through why we use a mask. So it protects germs from spreading to others and protects Fuzzy from getting sick, and it blocks those sneezes and those coughs. The gloves keep our hands clean, and this goes along with hand washing, obviously. And then the last is the gown, which keeps our clothes and body clean so that the doctors or the nurses or whoever are working with us don't spread those germs from the clinic or hospitals to their house. So really just breaking it down and using stuffed animals can make it less intimidating and really prepare them if they do need to go to the hospital or the doctor, and or if they just see this on TV. So again, just kind of going through, showing them that the mask, although it can be hard to look at or a little bit scary, just reminding them that it's a friendly face behind it. So for preschoolers, so this is ages 4 and 5. I think I said 3 and 4 last time, but ages 4 to 5 years old, it's essential to keep it simple while still being honest with the explanation of COVID-19. So it's really about what they're seeing and hearing and giving those short explanations. They will often dwell on what they see on TV or maybe what phrases that are being said, because that's how they're comprehending the information. So if they do have questions, just providing some simple answers. And a common developmental concept of this age is magical thinking, in which they believe their thinking caused something bad to happen. So for example, a preschooler might think that because they got mad at grandpa, that's why he got COVID-19, or that's why he's sick, or maybe that's why they can't see him. So obviously this is incorrect. So it's about reassuring them that it's not their fault, and they're not to blame for anybody's illness. And you'll likely have to repeat this over and over as they're really processing and learning the best they can at this age group. They are also very egocentric. So it's the question of how is this affecting me? And just reminding them that they're safe and they're loved, and you're doing your job to be their caregiver at this moment. For positive coping for this age, we must continue to allow as many opportunities and time as we can for play. Making hand washing fun is really beneficial, as it can be a hard task for this age. Baby Shark, Elmo, and Daniel Tiger all came out with hand washing videos, so check on YouTube for those. Be available for your kids to ask questions and talk about their feelings openly. Along with the infant and toddler age group, preschoolers really benefit from a consistent schedule and keeping to the routine that they had before COVID-19 as much as you can. As they are continually making connections and really building trust with those around them, support systems are really crucial at this time. So making sure that they're able to see those really main caregivers as much as possible. For school-age children, they will often have many questions as they are seeking as much information from those around them. Here are a few questions that may arise, so I'll go through each one. So what is COVID-19? So you can talk about how COVID-19 or the coronavirus is just a family of germs that can make people sick, and it's kind of like the cold or the flu. Doctors have medicine to help protect people from catching the cold or the flu though, but because COVID is new, doctors are working really, really hard to find and get some medicine to people at this time to really protect them. And then how is COVID-19 spread? So COVID-19, you can talk about how it's very contagious, and contagious means that it can spread really quickly from one person to another. And so this can really draw the connection between why we're physically distancing from other people or why they can't see their friends. And this connection is really important for them to understand so that they aren't as upset or can really comprehend, okay, that makes sense. We don't want to get sick, so that's why we have to stay home. And this can also go, and you can talk about how we wash our hands, and we want to make sure that we're covering our sneezes and our coughs. And then a last question might be, how can we prevent getting COVID-19? So again, washing your hands and making sure that germs aren't entering our body through our eyes or our ears or our mouth, or our eyes or our nose or our mouth, and really sanitizing as much as possible. And then you can talk about how we also can wear masks, and you might see people around the grocery store or other places, and that's why we are wearing them. And then you can kind of talk to your kids and make sure that they feel safe to ask questions as well, and really open up the discussion. Oftentimes, the discussions can be unexpected, so it might be during play, and you can really make sure that you're just calm and able to really help them understand by offering the space to clarify any information or correct any false information that they might have. A brief note on coping styles. So just like adults, kids vary in how they cope with stress, and some may be information seeking. So stress for them is really reduced when all their questions are answered and they get as much information as they need. And then the other is avoidant coping style. So this means that kids may feel bombarded even with a little bit of information, and this can really lead to that stress and anxiety. So just making sure that kids are in control of the conversation, you're not overwhelming them, and just refraining from constantly bringing up the topic of COVID-19. For school-age children, choices really allow them to feel in control when so much of what is happening right now is out of their control, like being able to see friends, having to stay home and not going to school. So helping kids brainstorm what they can do during quarantine. So maybe their hobbies, going outside, learning something new. So this age group really benefits from reassurance and feeling supported in what they're working on. So praise and positive reinforcement really go a long way and can help lighten the mood and bring some positivity to our days. This age group is very concrete in their thinking, so they may be worried about grandparents or loved ones that they can't physically see, so that aren't in close proximity. So therefore, maybe calling or Skyping them can really provide that relief and support that, okay, those people that I love, they're okay and they're safe, even though they're not physically with me. So adolescents are dealing with a great amount of pressure as they are navigating virtual learning and really have less guidance in their schoolwork. So they may also just feel isolated from not seeing their peers. Adolescents will need more detail, and since you may not know the complexity of the answers that is required, you can really take the time to find out the information together. And when you're doing it together, you know that they're going to get reliable information and not information on social media. Adolescents really should be in constant communication as much as possible and just be there in order to really provide them with that love and support, even if they seem a little distant. So again, helping adolescents cope, validating their feelings, especially the feelings of frustration and disappointment. All emotions are okay at this time for adults and for kids, as we really navigate the cancellations, the loss of independence, and the new routine that we're trying to really establish. So don't take it personal if they do want their space, but really allow that open communication when necessary. Be patient as they're really grieving aspects of their life, just as adults are too, and encourage them to take breaks and really enjoy activities that they might not be able to do when they're busy with school. The rest of the presentation will really include resources from reliable sources that recognize the importance of developmentally appropriate language and the need for for more fun activities for kids and families in the future. So starting with the World Health Organization, if you follow this search format, so home, emergencies, diseases, coronavirus disease 2019, advice for public healthy parenting, they have wonderful guidelines for topics, including keeping it positive, structure, bad behavior, and how to manage stress. I apologize as it may be small to read, but these are 2 examples of the WHO guidelines on COVID parenting. So they have great resources and they're really concise and relevant. So it kind of goes through broadly what we just talked about for the different age groups. So really check out those if you need help with just starting the conversation, or else if you just have a question. The next resource is from Kids Health. So you can go to kidshealth.com, and they have a great website with information pertaining to a variety of different health diagnoses for kids. They added COVID-19 to their database and have translations, which is amazing, in both English and Spanish. So their information includes symptoms and also preventative measures. The Child Life Disaster Relief website created handouts for coping skills and practical tools to help kids during this time. So some of the coping techniques include deep breathing, counting, music, dance, and just being in nature. The next 2 resources are really geared toward the younger audience. They incorporate beloved television characters from Sesame Street and Daniel Tiger to help with hand washing, building routines, and handling complex emotions. The Sesame Street in communities has videos and webinars in both English and Spanish for caregivers. And they also have fun activities to keep kids happy and occupied throughout the day. And they're really creative in how they can really engage kids. As you take in all of this information, I want you to know that right now you are doing a great job as a parent and a guardian. If you take anything away from this presentation, it's that your support and your love during this time is the best thing that you can give your child. We will all be okay, and we'll all get through this together, and keeping your child safe is really the top priority. So we may stumble over our words, or we may not have the right words to say during this uncertain time, but it's more than what you're saying. It's about the love, it's about being patient, and really finding joy in this uncertain time. Some positive coping apps for caregivers include Balance, Headspace, Sunvello, and Calm. All of these can bring balance and peace, even if just for a moment or two. I know I like to use them right before bed. And taking care of yourself really allows you to be a better parent and a better person for your kids. So you should never feel like self-care or taking 2 or a half hour out of your day is not selfish. Wrapping up, the 3 big takeaways to be mindful of is be mindful of your child's exposure to COVID on TV and social media. Be there to clarify and equip them with the accurate, developmentally appropriate language that we talked about. Secondly, your child is looking to you to stay calm and reassure them that everything is going to be okay. So validate how they're feeling, but really focus on the positive, like being together and really enjoying each other's company. Lastly, monkey see, monkey do. Wash your hands and your child will too. Children are a product of their environment, and your actions need to reflect the appropriate behavior that we need to see right now. So that includes hand washing as well as physical distancing. Thank you so much for your time today. I hope you all stay safe and remember to wash your hands. I will include on the last slide my contact information. If you have any questions or if you have a topic for me to cover in the future, I would love to hear from you. So thank you so much.